Right now, we're sending $750 billion overseas to these Middle Eastern companies and to some in South America in exchange for foreign oil. It's the greatest transfer of wealth in history. And we're sending it not to countries like England, Scotland, Ireland, Wales, friends of ours. We're sending it to countries that are run by dictators, oftentimes despots, that are not friendly to us. We have got to take this energy situation seriously. And that means to explore all options, put all options on the table, and to advance on all fronts. There's no question, and I don't think if you look at any of these policies and procedures, John McCain is much more prepared to advance on all fronts, and that will have a much more immediate impact. And it will also create more jobs here in America. So it's not just an energy solution, it's an American solution. Because as much as we like and respect Senator Obama from Illinois and the good things that he's done, under his policy we won't advance on enough of these energy fronts. We'll continue to send money overseas. That becomes more of a Middle Eastern policy. John McCain's energy policy will be much more of an American policy because we'll be creating more jobs for Americans right here at home.
Thank you very much. We have a brave soul here. I would encourage you to follow the lead here. Please, pose your question.
Your two candidates have very different approaches to the problem of health insurance here in this country. And I'd like you to spell out those differences and explain to us why you think each program is going to work and why the opposite side thinks it's not.
Let Rusty go first once. Rusty? Yeah, I wanted to go first on energy, doggone it. You did good.
Well,
that's a very good question because healthcare is a huge issue, and I know I personally faced it when I started my own business and had to deal with that because when you're self-employed, obviously I'm not getting employer-based healthcare. And so what I ended up doing actually was joining an organization for the purpose of being able to become a part of a pool that would then enable me to lower the rates because to buy them individually is almost prohibitive. But even that got to be a problem because I had two options. One of them was Blue Cross, one of them was another insurance company that was based here in Michigan. I wanted to try and provide them with the coverage so we could stay in Michigan. And when they took a look at our situation, they said, well, you know, this was amazing to me, but they said, you know, we'd be happy to insure me, and they'd be happy to insure my 3 children. But they weren't going to insure my wife because when she had our 3rd child, she ended up with gestational diabetes. And so once they saw diabetes on there, that knocked her off. So obviously we weren't going to insure everybody but my wife. So we ended up going to Blue Cross. But I'm very familiar with this problem because of my own situation as an employer, hiring people and having to provide health care coverage for myself, my family, my employers. What we have is really not a health care system in America. That's not what we have. People think it is, and we talk about health care, but we really don't have a health care system. We have a sick care system in America today. People get sick, they go to the emergency room. People get sick, they seek care. What John McCain wants to do is kind of turn that on its head. What we need to do is actually go to and move toward a health care system. That includes things like prevention, early intervention. And so he's got policies and programs that are going to reward that behavior both for individuals or hospitals, for all of the elements that are part of the healthcare system. Because what we need to do is start to treat this before it gets to the stage where people end up in an emergency room. I think between 75% and 80% of healthcare costs go to chronic diseases. These could be things like asthma or diabetes, which my wife suffers from. And so, again, what we really need to do is start dealing with that before it gets to be a crisis stage. You know, there's so many things to talk about, and I'll be frank and tell you that I'm not the expert on healthcare, but I do know that John wants to do a variety of different things. Senator McCain wants to do a variety of things. First of all, in terms of prescription drugs, we've done some things in the Attorney General's office here in Michigan with MichiganDrugPrices.com. And I know what the Senator wants to do is broaden the use of generic drugs so that we can bring the cost of drugs down, make the FDA approve drugs more quickly and still keep them safe, and also in terms of bringing drugs at the generic level so we can bring the cost down there as well. Also, there's a situation that we have here where most people in America get their health care through their employers. People that don't get their health care through employers are penalized because of the tax system. Because right now there's a benefit to employers who offer health care, but if I go out and pay, I have to use my tax dollars to purchase health care, and that's assuming I even can. So what he wants to do is create a level playing field that gives you tax credits, which will put more money back in your pocket so you can afford to do that. And what he also wants to do is similar to what I face, which is When I needed to buy health care on my own, it was almost prohibitive, and the only way I could see to do it was to join an organization, a small business organization that I got through the Michigan State Chamber of Commerce. And what McCain wants to do is make sure that those partnerships are available to all folks, the self-employed, people without insurance, so we can increase affordability and access to health care. If you do that, you will lower the cost and make it easier for folks to be able to afford health insurance.
Thank you.
I guess, unlike Senator McCain, Senator Obama believes that there is a healthcare crisis in America. I see it every day when I try to balance the state's budget and see that, unfortunately, I cannot offer health insurance to 1.1 million Michigan citizens, 50 million Americans across the country without health insurance. I think this is a national disgrace and something that will and must change. And I believe that Senator Obama does have the plan to put it in place. And I believe he can achieve it through a number of efficiencies and through, again, creating a national health care system. If you like the system that you're in, you keep it. If you don't have health insurance, if you're unsatisfied with the insurance that you have, you should have the opportunity to participate in our new national health care plan, just like every member of Congress and every staffer that works for every politician in America. Now, this plan will actually save American consumers $2,500 per family per year. How do we do it? Through tremendous, tremendous reforms. Yes, we do rely very vigorously on preventive health. We do we do rely on screening, but we seek insurance reforms. We seek streamlined efficiencies in reporting. We seek improved prevention and management of chronic conditions. And we increase competition amongst the industry. That's $140 billion in savings to American businesses. That translates to the $2,500 for every American. Now, this plan is reasonable, it is fair, and according to the Wall Street Journal and others, it is achievable and it is paid for. We believe that it is realistic. Senator McCain would actually tax. As he talked about employers, he would, for the first time, tax the health care premiums of Michigan businesses. And that simply is not the right answer to get us through this crisis. And again, it is a crisis. So I believe that if you want to have national health care, the choice is clear. You will support the Obama plan. Furthermore, for small businesses, the backbone of so many of our main streets, Senator Obama's plan will provide a 50% tax credit for employer-provided health care. I'm a small business owner, a failing small business owner, I must admit, and I would like the opportunity to provide health care for my employees. Under the Obama plan, I'll have a fighting chance, and I will accept a 50% credit to offer the right thing and provide that health care incentive for my employees.
Thanks. Thank you. Any brief response to that, or shall we move to the next question?
I could, but let's move to the next question. We've got a number of people in line.
Hillary.
My question is looking for an adjusted gross income dollar amount. My understanding, and I'm looking to either one of you, my understanding is that Senator Obama has a tax cut plan, and at least the ads and Senator Obama emphasize that it's for the middle class. My understanding is that the McCain tax cut plan would let the Bush tax cuts become permanent. There's something beyond that. My question is, under Senator Obama's plan, what is the middle class? What dollar level above which is there no tax? Or is there no cut? What is the level that he calls middle class? What's the top of it?
Those citizens making over $250,000 will see their Bush tax cuts rolled back, but not eliminated. Rolled back to reasonable levels, the levels of the 1990s, where America saw unprecedented economic growth. Remember the days of 22, 23 million new Americans finding jobs and participating in our society. Those are the tax levels that we're looking at.